In 2016, I had an infection that ended up covering about 25% of my skin. And in order to solve the infection, the hospital gave me a great deal of steroids and antibiotics, which destroyed my immune system and caused me to have chronic fatigue. I spent the next 4 months in bed, and over the last year and a half, developing a protocol that's allowed me to go back to a full day's work. Since then, though, I've had a great deal of brain problems and constant pain, nerve, muscle, joint pain that's there all the time. And it's really debilitating. I've worked really hard at making sure that I stay with it. So that involves about an hour and a half of work in the morning and an hour and a half of work in the evening, just to kind of stay even. And I felt myself over the last couple of months really slipping, just not being able to get back to even, not being able to get back to good. I've also had a number of different food allergies. Allergies have been a constant issue for me. And what they kind of show up as is that every couple days to a week, my body develops new allergy. So in June of this year, it was really hot, and I was drinking a lot more water than I typically drink. And I actually developed an allergy to plastic bottles. So I would rub my eyes, and the plastic that I was touching caused my eyes to break out, and I had significant open sores in my eyes for months at a time, and off and on. This week has been remarkable in that what my prior belief coming into the week has been that 95% of life is biomechanical, right? Like, I work really hard, and if I find the right protocol, then I get better. And that's been my experience over the last couple of years. Yesterday, Saturday, what occurred was that at around 5 o'clock in the afternoon, my brain kind of sent a typical signal to my body saying, hey, you're tired, you're about to have a fatigue event. And typically when I receive that signal, I have about 30 minutes in which to find a safe space to literally go to sleep. And I usually am asleep for 15 minutes to 45 minutes at a time. And oftentimes at the end of it, I don't remember what happened, the fatigue events. Sometimes I wake up from the fatigue events not remembering that a chair is a chair. You know, my body just simply stops working. So my body didn't respond to that signal at all. It just kept going, and I felt fine. And several hours later, my brain stopped sending the signal, and I don't expect it to send it again.
So how has this week been for you at the event?
It's been really challenging because I have had a lot less pain than typical. The pain has been lessening throughout the week. And historically, as I travel, and I travel some for business and occasionally for pleasure, we've wanted to travel much more than we have in the past, have been able to in the past, because by the third or the fourth day, without my vibration plate, without my chi machine, without my massage table, without my massage chair, right, without all my equipment that I've spent thousands of dollars on, my body's breaking down by the third day of travel. And by the third day of being here, I was beginning to feel better, more limber, have an easier time to move around, have less pain. I have also no longer any food allergies. I was able to eat dairy without any consequence. I was able to eat sugar without any consequence. It feels pretty good to have a normal meal. I meditate about an hour a day on my own. The meditations here were different than what I did, primarily because of the breathing techniques that were part of those meditations. It was the pineal breathing that was the linchpin factor in the difference in the meditations. I do practice other kind of breathing techniques, but that particular practice felt very different and had a very different result in my brain than those other techniques. I also felt that Dr. Joe's commitment, as well as the community and the level of vibration inside the community, made a massive difference in my experience of the week. I am absolutely thrilled because, you know, what was predictable in my future was that my body would continue to break down over time, that I couldn't possibly work hard enough to be able to get back to even, that there would be some flare. The issue that I have, according to the medical community, is mitochondrial. And so if I have a flare that's significant enough that it attacks my heart or my brain, recently I've had a significant change in my eyes. And so, like there's all different kinds of impacts that have happened, and that you never kind of know. I've lived like I never kind of know when the next one is going to be the one, if that makes any sense. And I'm no longer concerned about that.